In this second part of the nervous system, we will have a brief overview of the autonomic nervous system. The autonomic nervous system maintains the homeostatic functions of the body. There are two parts to the autonomic nervous system, the sympathetic nervous system and the parasympathetic nervous system. As you can see from this picture, there are already some differences between the sympathetic and parasympathetic nervous systems. While both systems primarily function through a two-fiber system, where a preganglionic neuron signals to a ganglion, continuing that impulse through a postganglionic fiber which signals the effector organ. Preganglionic fibers for both the sympathetic and parasympathetic nervous system are cholinergic fibers that release acetylcholine at the synapse with the ganglion. The parasympathetic postganglionic fiber is an adrenergic fiber that releases the catecholamines, norepinephrine, and epinephrine at the effector organ. While the parasympathetic nervous system postganglionic fiber is a cholinergic fiber that releases acetylcholine at the effector organ. One special situation with the sympathetic nervous system is that it innervates the adrenal gland, releasing acetylcholine, signaling the release of epinephrine and norepinephrine from the adrenal medulla, where it then travels in the blood to reach the effector organ. The sympathetic nervous system is our fight or flight response. This system will maintain our blood pressure and body temperature in response to stressors. Overall, think of the sympathetic nervous system as having a catabolic function, or something that breaks down substances to provide energy when threatened. The effects of sympathetic nervous system activation include an increased cardiovascular response, which includes an increase in heart rate, and an increase in blood pressure through signaling the arterioles to vasoconstrict. In addition, the sympathetic nervous system increases our blood sugar. The sympathetic nervous system promotes dilation of our airway at the level of the bronchioles to allow us to get in more oxygen, and it promotes dilation of our pupils to make us more aware. At the same time, it turns off some of our digestive functions through constrictions of sphincters in the stomach, intestine, and urethra, and by decreasing the release of digestive hormones and enzymes. The parasympathetic nervous system is our rest and digest response. Here we want to conserve energy and we want to build back. And so we replenish our resources and our storage of resources, and we maintain our organ function. Effects of parasympathetic activation include a decrease in our heart rate, an increase in our gastrointestinal function and glandular secretion to maintain body functions. It also promotes bowel and bladder elimination, and it contracts our pupils. Most of our visceral organs are innervated by both sympathetic and parasympathetic nerve fibers. You can see a figure here of many of the different organs that are innervated by the systems. One exception are that the blood vessels and our sweat glands are innervated by sympathetic nerve fibers only. So in the somatic nervous system, here we have signaling to the skeletal muscle with a release of acetylcholine here at this neuromuscular junction. But in the autonomic nervous system, things work a little bit differently. Our primary approach is a preganglionic neuron leading to a ganglion, where then a postganglionic neuron then continues the process. You can find the preganglionic neurons in the spinal cord or brainstem, where the postganglionic neurons will synapse with both the preganglionic neuron and the target organ or target tissue or target gland. These work a little bit differently in the sympathetic and parasympathetic nervous system. Most signals in the sympathetic nervous system involved a cholinergic preganglionic neuron releasing acetylcholine at the ganglion with a postganglionic adrenergic fiber releasing catecholamines like norepinephrine at the various organs. The sympathetic nervous system has two deviations from this major plan. One is that acetylcholine can be directly released at the adrenal gland, signaling the release of epinephrine from the adrenal medulla, which then will circulate through the blood and travel to the various organs it is targeting. In addition, the second deviation in the sympathetic nervous system is that a postganglionic neuron that innervates the sweat glands will release acetylcholine at the site. For the parasympathetic nervous system, the preganglionic neurons release acetylcholine just like all other preganglionic neurons. However, the postganglionic neuron is a cholinergic fiber that releases acetylcholine at the various organs. Now let's look at the two primary types of neurotransmitters in the autonomic nervous system, acetylcholine and our catecholamines. Acetylcholine binds to cholinergic receptors. We have two types of cholinergic receptors. The first are muscarinic cholinergic receptors. These are found on the postganglionic fibers of the parasympathetic nervous system, and they're also found on the sweat glands in the sympathetic nervous system, because remember that one exception in the sympathetic nervous system where acetylcholine is released at the level of the sweat glands. But this is a sympathetic nervous system action. We also have nicotinic cholinergic receptors. These are found on the autonomic ganglia and on the skeletal muscle at the neuromuscular junction. Acetylcholine is excitatory to most receptors. Some exceptions include inhibitory effects in the heart and in the lower esophagus. Acetylcholine can be counteracted by the drug atropine, but this is only targeting our muscarinic receptors. Our catecholamines include norepinephrine, epinephrine, and dopamine. Epinephrine makes up about 80% of the catecholamines that are released from the adrenal gland. Catecholamines bind adrenergic receptors, and we'll talk about two types, alpha adrenergic receptors and beta adrenergic receptors. Most catecholamines are excitatory, but depending on the dose and the location of the receptors, they may be inhibitory. Catecholamines can be counteracted by alpha or beta receptor blockers. Let's take a look at the alpha and beta adrenergic receptors. Alpha adrenergic receptors come in two forms, alpha 1 and alpha 2. Alpha 1 adrenergic receptors are found on vascular smooth muscle, specifically on the arterioles, and genitourinary system, including the bladder and the prostate. Alpha 2 adrenergic receptors are found in the brain, and these can be targeted for cardiac issues and substance use disorder. Beta adrenergic receptors include beta 1 and beta 2 adrenergic receptors. Beta 1 adrenergic receptors are found in the heart and in the eyes, where they might be targeted to treat something like glaucoma. And beta 2 adrenergic receptors are found in the bronchioles of the lungs, and these are targeted in the asthma response. And this is our brief overview of the autonomic nervous system.